MED21 is built on two powerful components working together as a continuous preventive healthcare system. The first is the Monitor Health Record, or MHR. Think of the MHR as a living, patient-owned health timeline. It continuously collects, organizes, and updates an individual's health information, from medical history and laboratory results to lifestyle habits, family history, medications, screenings, and physician observations. The second component is the Risk Intelligence Engine, or RIE. The RIE continuously analyzes the information within the MHR, looking for patterns, trends, and early warning signs long before disease becomes a medical crisis. Using evidence-based medicine and physician-supervised intelligence, the RIE evaluates a wide range of preventable health risks, including cardiovascular disease, diabetes, stroke, obesity, liver disease, lung disease, pancreatic disease, and gaps in recommended cancer screenings. A 30-year-old woman begins with what appears to be a simple digestive problem, stomach pain, bloating, and diarrhea after meals. She is treated as a type 2 diabetes patient and started on oral medication with rapid-acting insulin. But MED21 does not stop here. Through daily monitoring, physician review, and deeper clinical assessment, her case is clarified. C-peptide testing shows very low insulin reserve. The real diagnosis becomes clear: type 1 diabetes. Without the correct diagnosis and the right insulin strategy, the patient faces unstable blood sugar, dangerous lows, severe highs, and the risk of diabetic ketoacidosis, a life-threatening emergency. Care coordinators help the patient understand treatment. The Monitor Health Record captures the patient's data continuously. The Risk Intelligence Engine identifies patterns, risks, and warning signs. Physicians review the evidence and guide clinical decisions. Patient is monitored, supported, educated, and guided. Care coordinators help the patient understand treatment, follow-up, and lifestyle adjustments. With the right care plan, insulin is optimized. Acute risk is reduced. Blood sugar control improves. DKA episodes are avoided. Long-term complications are lowered. This is the MED21 difference. We move healthcare from delayed diagnosis to early recognition. From fragmented care to coordinated care. From reactive treatment to preventive intelligence. From patient confusion to patient empowerment. MED21 does not replace physicians. MED21 strengthens physicians, supports patients, and helps deliver better outcomes through continuous monitoring, AI-supported insight, and human clinical judgment. This is what dignified healthcare should look like. Earlier risk identification. Smarter care coordination. Better long-term outcomes. MED21 supports an elderly patient with long-standing diabetes, hypertension, and kidney disease. Not through fragmented visits, but through continuous monitoring, education, physician review, and coordinated care. The patient is an 80-year-old man. He has lived with diabetes and hypertension for 30 years, and kidney disease for 13 years. He first presents with recurrent dizziness. In traditional healthcare, this could easily become another isolated visit: treat the symptom, add another medication, and send the patient home. We takes a different approach. The patient is enrolled into the MED21 care journey. His goals are clear: improve blood sugar control, reduce dizziness, stabilize blood pressure, simplify care, and help him live with greater confidence. The first gap is identified quickly. The patient does not have a glucometer at home. He is taking fixed insulin doses without knowing his blood sugar levels. That is unsafe. Without daily data, insulin becomes guesswork. The patient is also explained why dizziness can occur in diabetes. He learns that diabetes can damage small nerves supplying vital organs, and that better glucose control may reduce symptoms and improve stability. The patient receives a glucometer, strips, and a blood pressure device. Now he can track blood sugar and blood pressure daily at home. Over time, he learns how insulin doses can be adjusted more safely based on readings and clinical guidance. His follow-up shows better glycemic control, fewer dizzy episodes, and more stable blood pressure. MED21 does not replace doctors. We gives doctors better information, gives patients better understanding, and gives families better confidence. Patient-owned monitor health record. AI-supported risk intelligence. The goal is simple: better control, fewer symptoms, safer medication use, stronger patient confidence, and lower long-term risk. This is how healthcare moves from reactive treatment to preventive care. The case is a 63-year-old man with abdominal obesity, hypertension, and breathlessness on exertion for 2 years. In a traditional system, he may receive generic advice: lose weight, stop alcohol, walk more, take medication, and come back later. MED21 does not work that way. We begins with the patient's real life. The first insight is lifestyle-related. His diet is reasonably balanced, but still high in refined carbohydrates, white rice, salt, and processed foods. The goal is to understand the pattern and guide realistic change. The second insight is behavioral. He enjoys morning walks. A former college teacher, he loves reading and intellectually engaged. These are strengths, not side notes. MED21 uses them to design care that fits the patient, not the other way around. Blood pressure is then tracked across the day. Multiple readings show that his morning walks are helping improve control. He sometimes takes his blood pressure medication, but not consistently. The picture becomes clear: track blood pressure carefully, improve control, and reduce medication dependence when clinically appropriate. Looking deeper. Over several months, MED21 follows his blood pressure, activity, breathlessness, medication use, and lifestyle pattern. Recommendations are tailored to his goals: keep him active, preserve the routines he values, reduce risk, and prevent his blood pressure from spiraling out of control. The result is better blood pressure control, reduced breathlessness, healthier habits, improved quality of life, stronger patient engagement, and lower long-term risk. This is the MED21 difference. We moves healthcare from one-time advice to continuous support. From symptom treatment to risk prevention. From generic instructions to personalized care. From fragmented encounters to a coordinated health journey. The goal is not simply to add years to life. The goal is to help patients live better, healthier, and more dignified lives.